Here with more. Centers for Medicare Medicaid Services, the administrator, Dr. Mehmet Oz, who is working on a new initiative with the White House for a digital health ecosystem in collaboration with private sector tech companies. Can you please, Democrats are saying that Republicans in their big, beautiful bill cut Medicaid. Can you please tell us the truth about that, number one? Number two, people are concerned about the high cost of prescription drugs. Tell us what the president's plan is.
Let's put all these stories together, Sean. I'm infuriated, I'm sure all the viewers are as well, that someone could be a millionaire on Medicaid. Unfortunately, it happens more often than you think. And the president, with the one big beautiful bill, wanted to crush fraud, waste, and abuse of the kind you just described. To do it correctly, you have to know who people are, where they are, and you have to give them control over their own data. We believe there's about $14 billion stolen by people who are duly registered and Medicaid in multiple states or on Medicaid on any of the exchanges. There are women like the one you mentioned getting away with criminal activity, stealing money from our most vulnerable. So what the president did was to say, listen, enough's enough. The bill protects the American public by making sure that we're beginning to get under the hood of some of these issues. But yesterday, he brought together 60 of the top companies in health and technology, and he said, guys, we got to do this. We've made the laws, you've made the rules, you've been violating them. We want you to voluntarily come in here and pledge to do the right thing. By that, he meant we want you to give people security about their own medical information, because it's theirs. You own your medical data. And that if they want, they're allowed to get that data from these companies and share it in ways that might be beneficial to them. For example, let's say you have diabetes based on your medical records. On your phone, it might be sending you a message about what food to eat, how to exercise, how to get better sleep. Again, based on how you're doing. It'll also give you advice about missed appointments, what medications you should have been taking. It'll help your doctor, because instead of typing away while they're supposed to be watching you and looking you in the eyes and being with you for that precious covenant you have with your doctor in their office, they're typing away because they're figuring out how much to charge and what prescriptions to order, and all that distracts them from taking care of you. This new revolution in health technology and making health better again, because it can actually make it streamless, work exactly the kind of way that modern technology has helped in so many other sectors of the U.S. economy, will be revolutionary. And it's going to save us, we believe, $100 billion in wasted administrative costs and some of the fraud, waste, and abuse that you mentioned. But the president, as you know, is always a 1-2 punch. The second punch happened this morning, and he started to address an issue that's been bothering him and a lot of Americans, the untenable high price of prescription medications. And in case you're worried about this in your own personal life, remember, most Americans these days are worried about their ability to pay health bills. It's the #1 cause of bankruptcy. They're choosing between groceries and their prescription medications, because we're paying 3 times more than the average country in Europe on prescription drugs. So what's the president going to do? He said, from now on, we want to be paying the most favorable nation price. Whatever they're paying in Europe, we want the same price. Think of it like NATO. It's a global security program. Everyone's going to chip in so we protect ourselves from external threats. But there are internal threats, too, like cancer and autoimmune illnesses. And we have drugs that work. But America is not going to shoulder the burden for the whole world. We're going to use trade and tariff, and the president's been clear about this, to push up the prices of these drugs overseas so we can drop our prices accordingly. And he put us to work today to talk to all these companies he sent letters to ensure they realize that we're serious about this. We want most favored nation pricing on our drugs. The American taxpayer should not be taken advantage of anymore.
This is a big deal, because as people get older and the high cost of medicines, and it really is amazing that if my numbers are right, I think we end up creating, the highest percentage of new medicines that are on the market, and then we end up paying the highest price because other countries have some type of socialized medicine system and they won't pay for it unless they get deep discounts. We should have most favored nation pricing for sure, and hopefully that'll be up and running really soon. This is a big 24 hours for healthcare. Dr. Oz.
Click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis. You won't get it anywhere else.